Hey guys, Dr. Gutierrez here with Dr.
Sanchez.
Hope you guys are doing good. Listen, today we said we're going to come across and what does it say there? Stream something else. Okay, we're going to come talk to you about shoulder pain, shoulder discomfort, right? What we can do for the shoulder, this part of your body right here. All right. What can we do? Well, there's a lot of things we can do. First of all, there's a lot of people that are suffering from shoulder pain, and they don't know that chiropractors can actually help with shoulder pain. They have no clue. They think that we just focus on the spine. But in all actuality, we actually can work on the shoulder itself, align it, do some rehab on it, and we can work on the structures also, like closer to that area of the spine and the neck and everything like that, because it all plays a role, right? So we're talking about here, we're talking about shoulder and movement of the shoulder, right? Okay, if you guys have any questions, make sure to comment. I think I can see the comments on this program that we're using, but I'll leave Dr. Sanchez to say a few words about what's going on.
Yeah, we talked about bringing up shoulders this week, and happy to discuss that with anybody with shoulder pain. There's a lot of different structures going on in the shoulder that we can deal with, and possibly stuff that might get injured with wear and tear or heavy lifting or throwing overhand, different kind of sports injuries, or just day-to-day stuff, depending on how you're sleeping and what shoulder you like to sleep on. That can all start to affect how the shoulder is moving and how the shoulder is positioning, as well as the postures we maintain. So if you're on a mouse on a computer all day long, you've got one shoulder extended during the day, or if you're a driver and you got your hands out on the wheel, a lot of times that's going to affect where our shoulder sits and how that may position it within the socket and stretch tendons, or put pressure on tendons that it really shouldn't, and that kind of irritates them over time.
Yeah, and what do you say to the person that says, well, I mean, we have different types of levels of injury to the shoulder, right? But let's get to the most difficult, right, which is like a tear of one of the muscles or ligaments or tendons in the shoulder. What would you say to somebody that's because again, there's different degrees, right? We don't know exactly. We'd have to do an MRI or whatever else you would recommend, but we would do something to kind of look at the structure. And I was talking to a patient today, and they were saying, and I've had patients where the surgeons say, "Hey, you got to do surgery," and we've been able to rehab them because we found that maybe the tear wasn't as intense, that it wasn't completely separated. It was a lesser degree, and we were able to rehab that muscle to accommodate the structures in the spine, and to keep everything intact, and to decrease the pain and rehab them. So what do you say to a person that says, hey, they're telling me I need surgery for my shoulder? What would you say? What would be your first reaction, or how would you deal with that?
Ideally, we'd like to see what kind of diagnosis we're going off of. If it's a partial tear, a full thickness tear is what we're talking about, and whether or not the pain and symptoms are affecting your quality of life, how that's going. Some people who aren't athletes or aren't high level athletes, they're not going to be doing a ton of throwing and different things that might allow you to go through all your movements throughout the day with no pain and no irritation. And regardless of that fact, you still have a little tear going on in there. And so you always want to take what you see on an image, whether it's an MRI, and put that into perspective as far as how that affects your daily life, and whether or not it is getting in the way enough that you need to take that last step of doing surgery to try to repair anything and or shave down things or whatever they're going to do. It's up to the surgeon at that point, but our goal is to strengthen and stabilize the joint. Stability dynamically is going to be done by the muscles, so there's a lot you can do as far as the muscle work, but you also want to do the passive stuff. So we can really get into that as far as stretching and flexibility of the joint, and then your body's going to be pretty adaptive to most things. So if you're just doing stuff around the house, your body might be able to use other muscle groups and stabilize the shoulder where that minor tear or that partial tear is not really affecting your day-to-day life, and you can bounce back from it and reduce that inflammation, and the symptoms go away, and you improve. So you rehabilitated yourself through the help of chiropractic or what we do here and home care, and going forward, then surgery is always going to be there, but we're just going to do as much as we can to help a patient get better. Right,
and it's not everybody needs surgery, so it's always good to get checked out. We can do non-invasive stuff that's going to help rehab you, like Doc said. It's important to get checked out first, see what's going on. Let's look at the structure and then go from there, right? So just to kind of show you a little bit, I wanted to show you guys some of the structure here. And as you can see, this is here we have the supraspinatus muscle. We have the what we call them the sits muscles that sit on the shoulder. And those are the type of muscles that usually stabilize your muscles of the shoulder that usually get irritated or torn or injured of some sort, right? And that's usually because of baseball or some type of any type of repetitive motion or things like that can injure these muscles. That's what we see most. But you have to keep in mind that there's quite a bit of muscles in the shoulder that need to be addressed, not just one muscle. And the way we do that, we adjust the vertebrae, like I said, close to the area and the neck, and we also work on the muscles around the shoulder, right, to help rehab. So there's different things that we can do that you may not be aware of that help without having to do we'll go to surgery, right? So that's what we're talking about today is trying to avoid surgery if at all possible. Again, and there's different types of diagnostic testing that we can do. One of them is an MRI. Would you do a CAT scan or something like that, or anything else?
No, not unless you're you think you might have fractured something playing rugby or something like that. You've got clavicle is pretty easily broken, but you'll probably notice a bump in the front there. So there are a lot of shoulder injuries that don't necessarily involve the joint itself. It could be the shoulder girdle, which is involving the clavicle and the scapula.
Right.
So scapula needs to take a direct hit if you injure that, falling on your back or something like that. But we also want to just throw out there that if you're having, a lot of people come in and say they have shoulder pain and they grab their trapezius muscle, or they have pain between the shoulder blade and the spine, and they're having a lot of knots there and stabbing pain going on there. A lot of times that really kind of takes us back towards the neck. So if we trace that back up and we trace the shoulder blade back up to where it starts, it's the beginning of the nerve root there that travels down into the arm and into those areas and creates pain outward. So it's not really the shoulder that's the issue, it's more a pinch on the nerve coming from the neck. So we'll have to decide based on your symptoms that we hear pretty often. We can decide whether or not it's the neck or the shoulder. Obviously the shoulder muscles get involved at that point, and that's why we don't neglect the neck and the nerves running to the shoulder, because one, they can be the primary issue, and two, it can still affect the muscles around the shoulder. If there's long-term pressure on the nerves in the neck, that will start to affect the muscles stabilizing the shoulder joint, and if it's not stable, then you are going to have shoulder pain. So it will be a problem, but it's more secondary to the neck being an issue. So that's where computer work and phone usage and posture becomes a big issue. That leads to further stuff. So like when your mechanic tells you change your oil on time, because if you don't, it could lead to something else, more friction within the engine, and that can lead to an engine fire. So you gotta cut it off early, otherwise things start happening further down.
Awesome. Yeah, absolutely. That's what that happens a lot. We see that a lot in practice. But another thing I just wanted to mention is that so if you're in an area where you're already injured and you start to feel better too, and you start taking medication, or you start to take maybe or get an injection, corticosteroid, things like that, that can also cause future problems because it numbs you for the moment. You know, it takes the pain away. But if you don't feel the pain, you start throwing the ball again or trying to go back to do whatever it is that you do normally. You could re-injure the area or actually make it worse because now you don't have that protection of pain, which is important. I know we don't like it, but it's important for us to know and for you to know when you have pain so you don't do that particular movement. So that's why it's so important to understand what is epidurals and what are these injections they do in your your spine and in your ligaments and your tendons and your joint areas. What does it do? And basically it just numbs you. Okay. All right, guys. So I don't want to make this too long. We already made it long enough, I think. All right, we got to go back and work on some patients. But if you guys have any questions, you want to say something?
No.
Yeah. So if you guys have any questions, we got to go back to our patients. Any questions at all, or is there a topic that you want us to kind of delve into a little bit more? Then just leave a comment and let us know what you guys what you want to hear about. What we can help with, because again, there's a lot of people don't know we can help with a lot of stuff. I mean, from headaches to just a lot of different things, from just stress and tension and things like that. So again, any questions, comment below, and check out our pricing. It's very good. We always do very good pricing here, and it's $29 for an adjustment. You can't beat that. If you guys want that, just comment that you want it, and we'll send you a voucher for that. Okay, guys, so I hope you guys are having a good day, and we'll see you again next Tuesday. We're trying to do it every Tuesday. He doesn't want me to put a time. You want me to, because we can't always make it, but we're trying to do it every Tuesday. Yeah, we're trying to make it every Tuesday. If we can, we will. But we want to be here for you guys and answer any questions. So look out for us every Tuesday, and we'll do videos in between the week to kind of talk about what we'll be talking about, what we've come up with to talk about. Okay, so hope you guys are doing good. Talk to you guys soon. And take care. Bye.
See you next week.